want to thank all of our partners for being here. I want to acknowledge Dr. Corona from Upstate, Dr. Stephen Thomas, the chair of the infectious disease from Upstate, Dr. Seth Cronenberg, our CEO of Kraus, Mr. Allen from Kraus, Dr. Christian Andrade, hopefully I got that right, Doctor, from St. Joe's, E.J. Donovan, the VA Hospital Emergency Manager, certainly our county team, which has been working very hard with our deputy county executives. In addition to that, Dr. Gupta is here, and you'll hear from her shortly. Dan Weir is our Emergency Management Commissioner. Jeff Van Beveren, our Emergency Medical Service. Jerry Payne, Director of Fire. Ben Rinaldi is here from 911. Commissioner of Social Services, Sarah Merrick. Certainly, Mayor Walsh is here. You'll hear from him as well. Chairman Knapp, I know if he's not here, there he is. Chairman, thank you for being here. Megan Cash from New York State Health. Thank you. Michael Bogozzi, New York State Health EMS. Julie Abbott-Keenan from our Health Committee from the Legislature. I believe I saw Mark Olson, representing the Village Mayors, Supervisor Ulatowski, representing our towns, Legislator Tim Burtis, Legislator Peggy Chase, Sydney Johnson from Syracuse University, Sue Tormey from Onondaga Community College, and Ann Kearney from Lemoyne. As you can see, the community is taking the challenge in front of us very seriously. We are all here. Everyone has been working collaboratively on this issue since it became very clear that the COVID-19 would come to our country. I spent the last 4 days in Washington, D.C., meeting with county leaders and executives from across the country. This topic was obviously the large topic where we all were able to actually be in a room and hear directly from the CDC, hear directly from the top-ranking White House officials, and really look and analyze what our plans look like in our communities, and it was very, very helpful. I want to thank the administration and the President and his team for meeting directly with our New York State delegation. Our request was for funding for New York State, and we're very happy that both the President and later on Senator Schumer confirmed that there will most likely be a federal bill passed for $8 billion of funding will be passed on to states, and there will certainly be language that that funding request will then also be passed down to counties. As you can see, we have everyone here that needs to be here at the disposal to really prepare the community for a plan. We will be sharing accurate and timely information with the public at all times, setting up that infrastructure. We're live streaming this event today. This event will be uploaded to the county's website. But certainly over the last 3 days, as I've learned more about the challenge in front of us and how communities are preparing for this, I certainly just want to reiterate this is not a time to panic. We are very, very well prepared. In Onondaga County, we have a wealth of resources. We are known for our eds and our meds, and certainly our meds are prepared for any challenge that is in front of us. And that's what we've been doing. We've been preparing and planning. We don't just prepare and plan for an event like this when one is in front of us, staring us in the eye. We have a team that does this year in and year out. We do not have any cases of the coronavirus, but like many communities right now, the likelihood is at some point we will have a case here in Onondaga County. In light of this message, it's now the time to take necessary precautions. If you are sick, please go to your primary care provider as you normally would. For businesses and all organizations, we encourage you to review your continuity of operations plans and make sure they are up to date if we see in the event of a community spread in the coming weeks and months. In terms of community spread, we will be reviewing this on a daily basis with our medical teams throughout the community, as well as our emergency management team. Obviously, we're hoping that this does not occur, and we're very happy in some of the communities today, in Oneida County specifically, in Erie County. It looks like some of the feared cases were not positive tests, so we're very happy about that for our colleagues. But if this does, we will undertake careful review and assess all the options to promote the correct policies, including potential social distancing. For continued information on the virus, We will be continually updating the Health Department website. There is a button on the county's homepage with the most up-to-date information, as well as frequently asked questions that are extremely helpful for the public. We also encourage the public to call 211 if they have any questions or concerns for immediate nature. This is another great resource that we have at our disposal. We also are certainly accessible to all of our partners who run and manage nursing homes, daycare providers. We'll be meeting later with our school district superintendents for a briefing on this as well, and any other individuals from the medical community that have questions on how to really deal with this threat in front of us today. Certainly, our health department has done an amazing job communicating and getting all the best practices and guidances from the CDC to them on a daily, if not hourly basis, but we do have people that can answer the phone as well. Saying all that, at this time, I would like to call Mayor Walsh up to the podium for a couple remarks. Mayor?
Thanks, County Executive. I will be brief. As you can all tell, the county is clearly the lead here and has brought all the necessary resources to the table. So I want to thank County Executive McMahon and his team for their support throughout this process. I want to acknowledge specifically Dr. Gupta and Commissioner Weirs, who we've been in constant communication with over the past month. We are taking steps to be prepared if we see local cases in the city of Syracuse. I've convened a city response team that is meeting regularly and will continue to until further notice. The team will continue to work very closely with the county. We're coordinating with our emergency responders at the Syracuse Police Department and Syracuse Fire Department to identify and prepare for the training and resources that they need to be prepared. And we're also, as the county executive suggested, for all employers, assessing other parts of city government to ensure continuity of operations and to make sure that we're taking the appropriate precautions. I'm sure you'll hear more guidance from Dr. Gupta and Dan Weirs, but right now the most important thing to do is just to stay informed. As the county executive said, there is information on the county website. We've also made information available on the city's website. And of course to practice healthy habits that are helpful whether we're dealing with coronavirus or influenza or any other health risk. So thank you again to the county executive and to all of you for helping us get information out.
Thanks, Mayor. Next, we're going to hear from Emergency Management Commissioner Dan Weirs.
Good morning. As everybody knows, this is a very rapidly evolving situation that we are actively monitoring with the Health Department. As mentioned, the Health Department is leading this response for us on behalf of the entire county. We are working with them on a regular basis to make sure that our community partners are better prepared and make sure that we have information to them. A number of things I just kind of want to highlight for people. As the county executive mentioned, we work around this stuff on a regular basis. We have a lot of stuff in place that regardless of the cause, we build these capabilities so that we can bring those to bear in response to any type of incident. Specifically in this case, we have a human needs task force that people should be aware of. Their sole purpose is how we provide food, water, shelter, transportation, and mental health counseling to people in the community if it is needed during an incident. We're meeting later with them today to have some more conversations. They're actively engaged in this, and they will be, and that's something that we work with on a regular basis. In addition, if this does evolve in this community where it grows, we are ready to support the health department and activate the Emergency Operations Center to support all the folks in the community and how we respond to this as a large group. Finally, I think probably one of the most important things, we have a large number of first responders in this community who are most likely going to deal with this on a first-hand basis. One of the things that we are actively engaged in is taking that information from the health department, from the CDC, and making sure that our first responders are aware and ready of what they might face in the community so that they have as much information as possible to protect themselves as well as to protect the community and limit any type of spread. Thank you.
Thanks, Commissioner. Dr. Gupta?
Good morning. Thank you for coming. Thank you, County Executive, and thank you, Mayor, for coming. And to our all healthcare partners, which we work regularly on a daily basis, for the lack of the better word. So the global novel coronavirus situation is rapidly evolving, as you know, and expanding. As you know, all the cases of novel coronavirus disease, what we call COVID-19, are appearing without a known source of exposure, both internationally and in the United States. To date, there are more than 94,000 cases globally, more than 3,200 deaths, and more than 51,000 people have recovered. This sentence has to be highlighted because we forget that people recover from this. In the United States, the cases have increased to 128 in 15 states with 9 deaths. New York State has, as of it now, probably 3 cases. 2 were confirmed, and this one case was confirmed this morning, seems like. Some of these cases are considered due to community transmission of virus from people who do not appear sick, which is concerning and poses a challenge for containment strategy. The main clinical symptoms can range from cough, fever, headache, shortness of breath. Majority of people, though 80% people, will have mild symptoms. It's very important to remember, and will recover. But those who are elderly with underlying medical problems and with a serious medical problem may require hospitalization with an increased probability of complication such as pneumonia, acute respiratory distress syndrome, including death. Incubation period, as you have heard about this disease, is about 5 days in a range of 4 to 7 days. And based on other coronaviruses, because this is not the first one which has appeared in the horizon, based on the prior history, the maximum incubation period for monitoring is considered 14 days as a precaution. The United States has been implementing an aggressive containment strategy, starting with travel ban. You are all aware of monitoring of returning travelers, which we do, and detection, tracking, and isolation of all cases, which we as a local health department, we are actively engaged in that. The goal of these intensive strategies is to lower the introduction of a virus in our community, which buys us more time to actually prepare, which we are trying to do at this point. The fact that virus has caused serious illnesses with serious complication, including death, and also can have sustained person-to-person transmission of infection with community spread is the one which is concerning to all of us, and that's what we adhere, both as a health commissioner as well as a physician. And this warrants a strategic response where we can prepare our community to implement specific strategies tailored to local circumstances that can blunt the impact of disease and can slow the virus. Every community is different, so we have to really cater to our own. At present, we do not have any pending or confirmed cases of COVID-19, as County Executive had mentioned, but it will happen in our community. It's a matter of time, but we don't know when. We have no way to predict it. This is the reason we are working fiercely and have continued to prepare ourselves to address any emerging public health disease, such as COVID-19, it was H1N1 before, in our community, especially when there is no specific treatment or vaccine for it at this point. How are we handling this situation? We are working on 3 areas. One is active surveillance of new cases and returning travelers from areas with sustained community transmission of COVID-19, ensuring plans for isolation and quarantine, providing guidance and assistance to the local medical community regarding testing and discharge. Number 2, we are engaging community partners like all of you who are here, educational institutions, nursing homes, daycare, to name a few, in order to prepare us together by joining forces and promote resiliency. These are key important things which we have to remember. And reminding that, and third, last not but the least, is reminding that everyone can and should play a role in reducing the transmission of infection by using simple preventive strategies, which we call non-pharmacological intervention. If you go to CDC website, you will say NPI. I think I want everybody to remember these names. And these will be very important tools in our response to this virus at the community level. This proactive approach of containment and mitigation will delay the emergence of community spread in our community in the future and reduce its ultimate impact, our joint combined goal. So based on what we have learned in H1N1 pandemic in 2009, if we could implement these all NPI measures, preventative measures, in a very aggressive and proactive way as a containment effort, we can prevent transmission of infection to a great extent. This is the biggest ask of all of you from where I stand. These 3 categories of non-pharmacological intervention or prevention strategies are personal protective measures. That means washing hands, staying home if you are sick, covering your mouth, simple things which we talk about during the flu season. Number 2, community NPI, what we call it, community preventive strategy, which County Executive mentioned. If things do go a little bit serious, social distancing, that comes into the play. and the school closure and dismissal if necessary. And last but not the least is environmental preventive strategies, which include surface cleaning measure. At the lower level, that's what we do when it's a flu season, and it will be different when we have a community transmission. I hope we never do, but that's the thing which we always like to remind. So finally, I would like to acknowledge all our partners who are here and who are not even here in this briefing, with whom we are working together to ensure health and well-being of our community during this emerging COVID-19 public health crisis, and we know we can do it together. We certainly need to be, I do think that we have all the right tools, all the right partners here, and we really should continue to work together, so thank you.
Thank you. Questions?
Dr. Gupta mentioned no pending cases in Onondaga County, but there are some people being isolated, and so how do you decide to isolate them, but maybe not test them, therefore not a pending case?
And so it's based off of traveling. So right now there's the information going into this event today. There's 12 individuals who traveled to China who are being watched at this point.
And watch means?
They're under quarantine.
Are those people allowed to leave their home and go grocery shopping?
Doctor?
So quarantine means that...
If you go to the next slide, thank you.
So quarantine means that they are going to be limited to their own homes, and depending on what their home situation is, if they have other family, they need to have their own bedroom, they need to have their own bathroom, and no shared things. People will be delivering food and supplies and medical supplies. Most of the time, people have their family members who actually can support that. If they don't, that's where we come into the picture in terms of trying to support that. If they would need some medication, we'll have to coordinate that. If they need food, we'll have to have that delivered to them. So at this point, it's very important to remember, these are asymptomatic individuals. They do not have any symptoms, and that's why they are quarantined. And we don't want to use word isolation, because isolation is when people get sick and they're isolated. So quarantine is to watch that period when they're asymptomatic. If they do have symptoms, they are in continuous dialogue with our nursing staff. So we actually have the phone calls with them. We check their temperature. We make sure that they report us temperature, and then if they have any needs. So there are daily phone calls with them, and then we record them.
How are you able to really enforce that someone self-quarantine will actually stay in their home and not go to work? At what point does it become something more enforced or severe?
Right, so it's a great question, and so far we have had no problem. People are very willing to actually do voluntary quarantine themselves because they want to protect not only their family but the community also. In some situation, actually, by the time we reach this, we already know that we have to do all these things because people are getting quite good information. The question which you raised is when it becomes that you have to enforce that. There are, at least as what I can say, that depending on the situation, as a health commissioner, I would have that commissioner's order, a designation that we can enforce that. However, most of the people, if you say into the history that 98% people actually comply with that. So, and a lot of times if you do reasoning with that, people are very willing to not only to protect themselves, but the rest of the community. I feel very comfortable saying that.
We've heard from SU Abroad students who have been recalled from Florence and they've been asked to self-isolate. What is the concern about Syracuse University specifically, and what is your message to those students about self-isolating and not coming to campus?
Right, so as you have seen, I think Syracuse University should be here. So one thing which we are continuously dialogue with them, and what they have been implementing, they send that, a lot of times email blast and try to inform them. A lot of their information a lot of their students have gone back to their hometowns where they are from, and because there was after 14 days they will be returning when they have the new semester starting. But if they are coming back to this campus because, or they are part of this community because they live here, then SU is the one who is monitoring at this point, and they are consulting with us on a regular basis. They are an excellent partner, and then they look for our guidance and are in a pretty much regular basis conversation with them.
Is there any specific advice or preparations for schools, preschool through colleges? Obviously, we know Syracuse University is always taking measures and monitoring the situation.
Yeah, we're going to be meeting school superintendents later today to update them with all the information and answer any questions. again, at this point, we're at the preparedness phase. And to your previous question, we've been working with Syracuse University and other universities who have abroad programs for weeks. So the amount of information and coordination has been tremendous, and part of the plans that you now see are because of those coordinations and how some of the abroad programs are ending. And these folks are going back into their own communities and these students. So there's been a lot of coordination with that, but certainly a lot of what we're talking about today is a moving target. We're preparing for what we anticipate to happen. Depending on what actually does happen, certainly the strategies will change with all the same people in this room today meeting and figuring out the best practice for our community.
The 14 people are only because they were in China, no symptoms?
12.
12, okay, 12.
Correct.
Will that be a moving target as people come from Italy or China or what countries as they come to the Syracuse airport? Will that list continue?
Yeah, that's going to be a moving target because some of those 12 people will be off the list shortly, right? So, and so that will always be a moving target for a period of time.
Regarding the testing, who's doing the testing? Is testing in your primary care at hospitals? And are there enough tests available?
So the testing is considering it has been, initially it was, the testing was done only by the CDC. Now the New York State Department of Health Wadsworth lab had started doing the testing. It is very well coordinated in terms of the way the process works, is that we are always in the conversation as a local health department. We help triage those calls. We work with the local primary care doctors or the emergency rooms, and based on the criteria for what we call patient under investigation, called PUI, which is recommendation by the Center for Disease Control and adopted by New York State Department of Health. Based on those criteria, we work with the physician, and a lot of times we can eliminate this person is not actually complete in this fulfilling the criteria. If they do fulfill that criteria, then we will coordinate that conversation with the New York State Department of Health and coordinate the testing. Most of the time at this point will be happening in the emergency department.
What does the testing entail?
So testing is the nasal swabs and respiratory, I think there are 3. Oral swabs.
And how long does it take to get results?
24, 48 hours, that would be. Wadsworth, we don't know exactly at this point. I think CDC was taking probably 48 hours or turnaround time. The Wadsworth lab will be shorter because we can, we can take that specimen or FedEx it there, so we should have that next day. That is depending on the capacity. This is still evolving at this point, that how rapidly New York State Department of Health Wadsworth lab will be able to provide that, but it will be sooner than CDC.
Has anyone been tested in Onondaga County yet?
So we had one person tested quite some time ago and was negative.
The governor said in a press release yesterday that they'll be issuing new cleaning protocols in schools and public transportation. I know you're meeting with the superintendent today, but can you kind of talk about that, and if the governor's office is in contact with you, or what you plan on doing with that?
Yeah, I look at it as elected leaders and public leaders. We all have professionals that this is what they do, and they're experts in this field. So the governor's listening to his team. They're looking at the CDC protocols, and there will be some basic things that make common sense, but you need to reiterate them. And part of this process is these things that are preventative do cost money, and a lot of it's people and whatnot. So that's why the federal funding and some state funding to this is important. But we'll wait. Certainly, we're going to be having conversations with the school superintendents on things that they've already done and what their own individual plans look like. They're going to ask us questions, and they'll ask us for recommendations. And the key here is just to share information and keep talking. And I think, honestly, after witnessing the communications from the White House to the state and on down through the local communities, I think the communication certainly between governments is unprecedented, and I think New York State is very well positioned to handle this. The testing timeline is something that some of you asked about. I don't know if the hours, the turn time today will be the turn time moving forward if there's more cases. But certainly I know that the individual in Westchester County, I believe they tested them yesterday. I believe that there's reports that there's results back today. So certainly the fact that the federal government allowed New York State to do testing is a huge win for our community and getting out in front of us.
How will $1 million
we
in
see,
state funding be allocated to this area?
Oh, how much?
The $40 million.
Well, I don't think we're gonna get 40 million, but I would appreciate if we did. But certainly that's one of the challenges that we're going to have Dr. Gupta talk to some of our medical providers and partners about what that looks like from various levels. Part of this, certainly manpowers, women powers of ours are going to be. It's going to cost more money. We're the government. Many of our folks will need to be paid overtime or comp time. But in addition to that, we need to see what the parameters are around those funds to really determine what the plan's going to look like. So,
Brian, if Syracuse saw a big outbreak and the hospitals ran out of capacity, where would seriously ill patients be diverted to? Does the county have a plan for a secondary location?
yeah. Look at everything's evolving. I think you're talking about potential surge sites for testing. You're talking about potential isolation sites if folks come in. Right now, we're very lucky we have the infrastructure we do with all of our partners. We don't foresee that being an issue, but that's going to be a conversation with our partners and a more formal plan will be available at a later date.
You've been advocating for people who feel sick to stay home. What about the individuals who do not have sick leave time? Any advice or plans for them?
Look, I'm reading as well that in the governor's budget, he's going to try to address that issue here in New York State related to COVID-19. So we'll do that. Certainly, we're looking at our internal policies and procedures for our operation, and that has to do with our continuity of operations plan as well. So we'll be discussing that specifically with county government, what we can do. But I don't want to speak for all employers because you're certainly going to have various employers that probably don't recognize the severity of the challenge. But this is not something, if you're an employer, you want to take a risk for either having your workforce exposed and potentially having your workforce out of commission for a period of time, right? So this makes sense for the business owner to be smart, and that's why we're encouraging the business community to review their continuity of operation plans, stay in contact with us so they can make informed business decisions so that their workforce, which is the key to everything, it doesn't get drastically impacted because one person was worried about having 1 or 2 days of paid sick time.
This question is from Mayor Benoit. The Central Bus Station, hundreds of people go on those bus stops and buses every single day. Have you been in talks with them about cleaning those buses and how not to transmit certain coughs or diseases as they go about their work?
Yeah, my office has been in touch with Centro. Obviously, Centro provides services much far beyond just the city of Syracuse boundaries, but we have been in touch with them, and as is the case with any employer, they're looking at their existing processes and procedures, but we have been in touch with them.
Is there
Have
any
they talked about cleaning procedures at all? Anything being done as of right now?
It's my understanding that there has been discussions about cleaning procedures. I can't speak to exactly what they're doing and when, but that has been discussed.
Is there any concern of transit interruptions, whether it be airports, bus stations, as mentioned, malls and other places we gather?
Yeah, look this is, we hope not right now, right? And so that's, this is not a time to panic. People need to live their lives. But as, facts on the ground change, we will adapt, and we are planning, for multiple what-ifs right now with people whose lives they are to plan and to treat the public health of the public. So certainly, we're not at a point in our community where people should not go shopping and should stay in their house all day long and should not go to work. If you start to see symptoms and you're sick, stay home. If your kids are sick, keep your kids home. And so that's just common sense regardless of COVID-19. So, certainly this is not, the purpose of today is to brief the community on the response and the planning and preparation done by a multitude of partners, and to let the community give that information, let them know where they can get information. It is not to press the alarm button, because that's not who we are.
Right now, so many of the cases are affected to or are connected to travel. At what point does community spread become the suspicion that if somebody wakes up sick and they haven't traveled, that COVID-19 is one of the possibilities?
Well, I'm certainly not a doctor, so I'm not going to speculate on that, Andrew, but certainly I think within the medical community there's an awareness of this, and it's certainly something that they're going to try to rule out. I don't know, Dr. Gupta, if you have anything more you want to add on that?
Yeah, I wonder at what point does, when somebody in Onondaga County wakes up feeling sick, right now it's likely the flu or another virus, but at what point do you suspect what has to change for COVID-19 to be one of the considerations?
So identification of case by the way the investigation protocol does not change. It is very clear that the physician takes the history. At this point, the travel is important, but at the same time, because of so much other places community transmission has occurred, that it's in the back of everybody's head that how are we going to assess. So the first thing, depending on their symptomatology, they are still going to rule out whether there's an influenza. We still have flu in our community. There are other common cold viruses which are still circulating, which are part of the viral panel, which are going to be still causing the problem. So they need to rule those possibilities out before you jump the gun. That will be a conversation at this point. I don't think we can hypothetically talk about that, but these are the things which we look at everything. If there is no travel connectivity, what is the possibility of this person depending on how sick is this person? So at this point, the criteria will be mostly for hospitalized patient. That is a very important thing to remember. And and also you have to remember that the PUI, what is the patient under investigation criteria, this is the second change has occurred, and they will continue to evolve that definition also. So we have to be at the top of it, and that's what our physician community is pretty much continuing to follow those. And that's what CDC and New York State Department of Health continues to provide that guidance. And locally we work with our physician leadership and the community to make sure that they have all the right information and at least at this point whatever is available.
Are the testing supplies local already? Are there some here? They're not.
No, everything is going to go to, so specimen will be taken here if that seems like a right patient fit the criteria, and that will be transported to the Wadsworth lab, which is in Albany.
Which hospital will be designated for those cases?
So there's no, sorry.
Yeah, right now, the plan is that testing will be done at any of the hospitals that the patient goes to and chooses. Certainly, as things evolve, if there is a community spread, we will look at the plan and look at some of the considerations that were talked about earlier with capacity in the various hospitals and the various triage units. And then, as a community, we'll pivot if we need to. But right now, certainly, an individual can go to any hospital they choose.
I know you said you've been in touch with, nursing homes and daycare centers. What about other businesses like restaurants, gyms, anything like that? Do you plan on sending something out to local businesses, or how do you plan on?
Yeah, that's part of us, really getting all the information out on our website and whatnot, encouraging folks to really look at the frequently asked questions, to stay in touch. We'll continue to, as information comes to us, we'll be there. We've already learned a lot on how to deal with this and prepare for this from what other communities have done. Certainly, the King County Executive was supposed to be in the same room as I was down in Washington, D.C., and he flew there and had to fly back right when he landed in D.C. to deal with what they're dealing there. So we're learning a lot from what they did. We're learning a lot from the government preparedness side, what happened with the San Antonio case, where you had the town and the county doing different things. Everybody is learning and evolving. I think the beauty about being in central New York is we are not the ground zero location for most of these cases. So that gives us time to learn and develop best practices and figure out what not to do that other communities did. And I think right now we're as prepared as we can be, but we know we have to pivot as different challenges come specific to our community.
Wyatt, are there any plans to reach communities, let's say the homeless community and others who might be less inclined to go seek out to get medical attentions and may not even realize they're ill?
Yeah, we're working with all of our nonprofit partners that are really an extension of county government to really impact all of our various communities. So certainly we are the funder for many of our partners in the nonprofit community that deal with our homeless or our individuals who are on the streets, and we're going to be keeping them briefed as far as best practices and what to do when confronted with some of these challenges.
If someone is traveling to Syracuse, should they contact the health department and say, hey, I'm arriving on a flight from China or Italy or whatever city? Is there a protocol for people traveling to these widespread areas?
Well, right now, I believe travel has been banned from China and Italy and Iran. One of the challenges, to be blunt, that one of our partners in Western New York has is that Canada has not banned similar travel. And so right now in New York County, and which is the Buffalo region, and you have the border there, that's a challenge, that's a concern, that's something that we have to watch. But right now, I think getting out early with the travel bans actually has worked out well for our country.
Question for Dr. Duke, excuse me. What would you say to people that are comparing this to the flu, pneumonia, maybe doubting the severity of the disease?
So we get a lot of those phone calls
Yeah.
because a lot of times is people are anxious and they, when anything new comes out, they just feel like it is happening to them. It's just something in medical school we call third year syndrome. Everybody thinks we got all the diseases. So that's why I think there is so much, it's so important for our physician community, which is playing significant role in fielding those phone calls from their patients, and they are directly communicating with us. They have all those, at least toolkits at this point, which is provided by the CDC, and then continue to inform, continue to get new information, and then communicating with ourselves, with myself and Dr. Wynn, both who are in the health department, that we go through the scenario and then try to identify whether this person could have something. If there is a already established diagnosis, there's no reason for us to think of something else. If you, and I would encourage you should actually look at the CDC website, even though you're not a healthcare professional. It's very well written, that you will have a very clear understanding of that, how the criteria are written, and then it gets kind of clarity. And also relieves anxiety, and also in CDC website there's information for people who how to prepare themselves, and what in the FAQ question, as county executive has mentioned, that the way we have created our web page, essentially that it lands on the CDC FAQ question, and there are different links there which takes you for the businesses, for the schools and different places, so people can get a lot of information. And also New York State Department of Health has a hotline, 188 number, which is also at the same web page. So people have a lot of information and resources there, which I would encourage everybody to actually get really used to that, because it's continuing to evolve.
Can you help people understand exactly what is the severity of this virus? Is it the fact that it's killed many people? Is it the fact that there's no known vaccine? Is it treatment? Is it that we don't know the cause of the contamination? Where is the severity coming from? Because I think a lot of the anxiety is all of these unanswered questions. And even yesterday I was reading, the death toll seemed a lot higher because much more milder cases had yet to be reported. So where do we stand, and what kind of severity are we looking at with this?
Doctor, go ahead. Dr. McMahon will get up here. Let's keep the professionals.
So it's a wonderful question, and I think the anxiety comes because it's a new virus. That's why it's called novel, right? It's a new virus, and there are so many unknowns about that. We initially talked about incubation period. Can it be 14 days based on the prior other, MERS and SARS and all those things. But in this one, it was like 4 to 7 days. So what is 5 days? But as a precaution, we kept the incubation, the monitoring up to 14 days. It is contagious. We know that. It's a droplets and fomites different things. But is it like measles? It doesn't seem like that's what like a measles, so it cannot be suspended for 2 hours if people leave it. So there are so many questions which are partially answered, and we continue to learn as we are looking at internationally a different community, what happened in Italy and South Korea and China and Japan, and what is happening in our own California and Washington. And then trying to take lessons. I think the scientists are really working day and night, not only with the modeling, but also trying to see their pattern, how to track those things. So at this point, what the facts are, that majority of people will have mild illness. That's something, these are the facts. So we need to stick to the facts. And there will be fatalities, as you have mentioned, and we all know that. But considering that so many, maybe a lot of asymptomatic people didn't come into the attention, could it be lower? At this point, it's like a 2% fatality. That's what we have been informed at this point, and that's what we should stick to that without any speculation. And to make sure that, I think that at the end of the day, everybody needs to ask the question, yes, there is no vaccine, there is no typical treatment at this point, everything is work in progress, but there is something which all of us can do, is that take the matters in our hand to take care of ourselves. Simple preventive measures really have a significant impact. So that actually then it empowers people, because you can make some difference in taking care of yourself as well as your family.
You sort of answered this question, and this is going to put it harshly, but viewers at home who are wondering, if I get this, am I going to die? What do we say to that?
So again, it's something, I would not say that that's something, if they are going to get it, they have a health professional who they are going to talk to, and they are going to provide all the information, get the clinical evaluation, and get the testing, and get whatever the doctor advises them to do, depending on the clinical situation. If they are sick enough to go to the emergency room, they will be taken care of in emergency room. If they are stable, they have a cough and a little bit of shortness of breath, they don't need to go to the ER. We don't recommend anybody to just walk in there. And even walking to the physician's office, they got to call their doctor on the phone. That is very important to make sure there is a connectivity between the patient and the physician's offices, so to protect others. I would not keep that kind of negative thing. I think it will be that, yeah, it's here, we are going to handle it. We have a large group who is working together to make sure that it's contained to its path wherever we can, and if it comes, we'll deal with it.
Is there enough work happening at physicians' waiting rooms and emergency room lobbies that if somebody comes in with, whether it's the flu or maybe down the road a local case of coronavirus, that it's not spreading to people even in their own transport and waiting for treatment?
So at this point, I think most of the outpatient providers will be taking the flu precautions. Everybody takes flu is contagious, and whatever the preparation they have it for any infectious disease, they are going to take that. Emergency rooms are very well prepared in terms of, there are usually what we recommend is to have the policy and procedures for any infectious diseases, that if the patient comes coughing and sneezing, and put the mask on the patient and then take them to a room which is a negative pressure, which is the respiratory isolation room, and then go with the what we call personal protective gear, depending on how the clinical situation is. So ERs are very well equipped because they are part of the big health system. Outpatient providers may not be not so, and that's why we are having this issue that where it should be testing, how do we triage them at this point until they are much better prepared.
Dr. Gupta, there's been a lot of information about the coronavirus. Just short and simple, what are 3 things people need to know if they feel like they have been exposed to the virus?
So we at this point will talk about if there is a travel history, that's the first and foremost. And also if they have any symptoms suggesting of it, because physicians, remember, they can't diagnose themselves. The patient cannot diagnose themselves. So they need to have all the right information when they talk to their doctor and provide all those things in a clarity and follow the guidelines which they are going to do. The third item which they can do, that will be true in any flu situation, is that make sure you do everything to prevent any infection to come to you. If you're sick, stay home, wash your hands, and cough and sneeze with the cupping your mouth. All these things are so important. They are underestimated at times, but the studies have proven that it prevents the transmission of virus. Even in pandemic it happened, and truly it will happen here too.
I mean, going off of Caitlin's question, people are very nervous. I mean, hand sanitizer sold out, Lysol sold out, disinfecting wipes, all of that. What message do you want to send to the people at home just about the coronavirus, about this?
Look, it's not good right now. We're preparing diligently so that when there is a case, which is likely, it may not happen, but it's likely there will be, that we're able to treat this person quickly and efficiently in a safe way. To Andrew's question, certainly with first responders, in any event, our first responders are going to know in advance if it is a potential COVID-19 situation, and they will be preparing so that the transmission is not likely at that point as well. So I think the key takeaway is many people who are experts in what they do across the country are working together, specifically in our community, and this is not a time to panic. It's scary. There's been other things that have been referenced in the past, when measles, SARS, other things that people predicted would be very bad in every community, and hopefully this situation will go that same way, and it will be a lot of fear and a lot of talk and a lot of preparedness, but very little actual there.
We keep using the phrase self-quarantine. Does it get to a point, or at what point does it go from being self-quarantined at home to perhaps hospital isolation? If that happens, would hospitals here be prepared for that?
Yeah, I think if you get to a point where isolation, you've been tested positive for the virus, and then certainly our hospitals are ready, and they're all here today, and we're continuing the dialogue and the planning every day as we get more information from other communities in other countries on what's actually happening. We reference the science, what's happening with the virus, and what do we know, because every day you know more. These very smart people have best practices that may pivot the strategy.
Do you name the hospitals who are here today?
We have Upstate here, we have Krause here, we have St. Joseph's here. Am I missing anyone? The VA is here.
Brian, what's your biggest worry right now about coronavirus?
Yeah, you know what, I thought the fact that I was where I was for the last 4 days was really helpful as far as me easing my concerns, the access we had to the individuals who are literally leading the charge on this issue throughout the country. So I feel that we're prepared, and I feel that we have a great team in our community, and I feel that our partners in higher ed have made excellent decisions to date, and I feel that our community is where we need to be, and we need to continue to evolve, and we need to continue to communicate specifically with some of these groups where you have vulnerable populations that if they catch the flu, they are at risk for very bad outcomes with our seniors and our young people. So this is nothing different from that. We know that if our vulnerable seniors who are sick catch the flu, it's a little bit of a fight. So we need to get in front of the curve there. Our teams are doing that. And as we get information, we will update the public with that information so everybody can feel prepared. And this is something that we really need the public to take seriously. And if everyone takes it very seriously, I think the impact on the community will be good.
There's a question for Dr. Gupta. You're seeing around the country a lot of people stockpiling masks. You're already starting to see people walking around the street wearing masks. What recommendations does the health department have regarding masks?
And if I'm wrong, the doctor can correct me on this, but my understanding is that people who should be wearing masks are the medical professionals and the people who have the COVID-19. I've been in a lot of airports, I see a lot of masks these days, but doctor, I don't know if you have anything else to add.
So the regular masks which are available over the shelf, if you are sick, coughing, you will protect others if you put it on. That's a good thing, that's not a bad thing. But providers, it doesn't protect them. So when the physician sees the patient or a healthcare professional sees that patient and directly in close contact, they have to wear a special one, N95. They are fit tested. So that's a very different one, different kind of thing. So we do not recommend people buying and having that. I think simple measures in terms of washing hands and making sure protecting. If you're sick, of course, yes, you cover your mouth and face. That's different. That would be good. And don't touch your eyes and try to touch everything. So that is important.
Well, are you like most stops with you? I mean, if decisions have to be made, you're obviously going to follow state and local or federal. But how much leeway do you have? Let's say we're going to shut this school down or something.
Look, Dr. Gupta has specific powers that she's charged with, and I think the medical experts in this community will drive the policy decisions, not political leaders. And so we will help implement their recommendations. And so I'm very confident if there's a community spread at some point, if everyone who are experts in this space determine that there needs to be an individual school that needs to be shut down, that those leaders in that community will work with our experts. And certainly that's a disruptive scenario where we don't want to see that happen. And it would only be a scenario if there was a true need for it. So I'm going to be relying on our health commissioner, who is a nonpartisan appointment. She has a 6-year contract, no matter what she tells me. So unlike some of my staff, where they tell me they have fear of retribution, Dr. Gupta has no fear of retribution. So we'll listen to Dr. Gupta, we'll listen to all of our amazing medical professionals and our emergency management team on how to do this, and we'll update the public every step of the way. I feel like we've been getting excellent advice to this point, and we'll continue to get that.
Doctor, other than, let's say, the flu, can you think of a time in your career or as your time as health commissioner where you've had to do this level of public outreach for a virus or preventing infectious disease to be spread?
So I have been here since end of 2014. H1N1 happened before, so I was not here, but certainly prior commissioners have handled it the same way. Since I have been here, we had like mumps, all these things, and TB at times, and a lot of those things in health department we continue to address on a daily basis, so not to become outraged. So at the local community, we are pretty much as a guard of everything. When the closest is come, which is not infectious, the harmful algal bloom, that's what we had done a lot of outreach at that time, the skinny atlas, when we had the HAB thing. But that's what the role of health department is. That's what the emergency management. We work together in terms of working with all the partners to bring everybody, all the stakeholders together, because everybody has a piece of the solution. And if we have all those solutions put together, we have a perfect picture, and that's what we try to do.
Dr. Gupta, what would you say to the more vulnerable population, people with cancer? I myself have an immune deficiency. I'm going to see my parents in a few weeks. They're from Westchester County. So if they happen to be exposed to COVID-19 and they could be carrying it without knowing it when I see them, is there more things, or are there more things that people who have compromised immune systems can be doing to protect themselves?
So at this point, depending on, I cannot answer you specifically in your situation. I think you will have to talk to your physician about that. In general, if there is somebody, asymptomatic individuals, at this point at least, what the science is telling us that the chances of transmission are not there. Again, there is a question mark there too, but that's what we are relying on. And making sure what you can do is using those protective measures, as I have repeatedly reminded everybody. If somebody is sick in your family, and then if you know they were in that community, it would be good to have a good dialogue before you make your travel plans. And also take precautions if you are there, even though they are well, making sure, because there could be other people who you could expose to. Washing hands, making sure that you are protecting yourself in many ways, keeping your hand sanitizer when there is no salt water available. A lot of times it's how much your situation is depending on if somebody is under therapy, not therapy, how far people are. These are the good guidance. I think a conversation with the doctor will be very important, your own doctor, because that person knows your history and going back and getting that information from your parents to that, what if they were exposed to anybody, and when there is a community transmission, it becomes a concern rightfully. In your mind, that's a good question, but a lot of those things you would have to tread the water based on their movement and your own movement and your dialogue with your patient.
What are some of the biggest challenges you guys are facing here in Onondaga County in terms of, trying to, prevent or stop the spread of the virus? Are there any challenges?
Well, yeah, you're preparing for numerous scenarios that you don't know are going to happen or not happen, right? So there's certainly, as Commissioner Weir's talked about, this is what he does with his team, right? And they work specifically with our health department, whose charter is the public health of this community. So there's a lot of planning going on, and then as information comes in, vetting that information and understanding if that is something that is a similar concern from other communities, or if it's something that is only specific to that community. So again, we're learning every day about this. The medical community is learning more and more about it, about how it's here, how it's spreading, and that will be a moving target. So that's a challenge, but certainly we like where we stand today, and we have time is on our side. The more time you have to prepare, the better. And right now, so far, having no confirmed cases is a very, very positive thing. Any other questions?
No cases, no under quarantine?
What was that? We have 12 travelers under quarantine.
12 travelers under quarantine.
Yes.
The one case that came back negative, what's the history on that specific case in Onondaga County?
I mean, that's a traveler. Other than that, I don't think we don't talk about specific cases, and that's a traveler. That's the only thing which we can pretty much share.
Was exhibiting symptoms though? What would cause that one test to occur?
I mean, that's what is in the very initial stages. So if there are symptoms suggestive of that, that's why we go and get that testing, because you have to kind of go over the criteria and then see this person, can it fit the criteria, and sometimes even the softer criteria. So the testing was done at that time.
Okay, I think everybody will continue to update the public via all of our communications, and anything that certainly merits another briefing, we will call another briefing. Thank you.
Thank you.